numbers fall again to make it even more affordable because this person makes even less income. Again, it's applied to the same silver plan, and you'll notice as the income goes lower, the amount of tax credit is also higher. And then lastly, this 94% cost share reduction, this level of benefits is available to individuals or households whose income falls just above that Medicaid threshold. So they're right above eligibility to get that cost-free coverage through Husky D or perhaps Husky A. But you'll see that that brings the annual deductible way down to 0. And it also lowers that amount that they would be paying for their copays and their co-insurance, out-of-pocket max, etc. And it also brings the cost of that silver plan with the tax credits they also get at this level way down to just that $54. So this hopefully kind of demonstrates what these cost share plans look like. All right, so moving on to advanced payments of the premium tax credit. I think that this is probably the trickiest of all of the affordability programs just because there are so many requirements associated with it. So as I'm sure many of you know, the advanced payments of premium tax credit are, well, their tax credits paid in advance to the insurance company on behalf of the individual or the household that lowers the monthly premium cost of the qualified health plan. Advanced premium tax credits can only be applied to a qualified health plan, and I listed just most of the requirements here. They are only available to households whose modified adjusted gross income at the very end of the tax year falls below a 400% threshold of the federal poverty level. And this next one is really important. Advanced payments of premium tax credit are only available to people who do not already have affordable, qualifying minimum essential coverage through an employer or through other government-sponsored programs. So that actually takes out, I mean, I'd say a majority of people from qualifying for advanced premium tax credit as people are becoming more aware of some of these eligibility rules, or as consumers and clients are becoming more aware. I've found typically that they should be qualifying for employer coverage or for, you know, let's say, you know, VA benefits, TRICARE, Medicaid, etc. In order to qualify for advanced premium tax credits, a household must file taxes for the year in which they are receiving these. This part is really important just because at the end of the year, as a household files their taxes, there will be a comparison of the income that they projected in their Access Health Connecticut application, as well as the income that they actually end up making. And there is a reconciliation in that they either may need to owe back additional tax credits, or they may be able to collect additional tax credits. But either way, that filing is very important because that reconciliation does need to happen. And if someone doesn't file their taxes in the year in which they receive tax credits, then they actually would be barred. They would not be able to get tax credits for any upcoming years until they reconciled what they had received in the past. And then lastly, in order to receive tax credits, a household, they must be residents of the state of Connecticut, and they must be U.S. citizens or lawfully present. And then the very last note I wanted to make here is that one last requirement: if an individual is married, they must file jointly with their spouse in order to receive these advanced premium tax credits. The application system is built so that as long as they list with the household lists in their application that they are married filing jointly, they will receive it, and they will receive it. And on the other hand, an applicant will receive a denial of tax credits if they've listed that they will file separately. So the application system should account for this, for all these rules, but sometimes I find that the consumer themselves may not be aware of them and may not understand why they're not qualifying for these advanced premium tax credits. So I had touched on this in the earlier slide as well, but advanced premium tax credits are really only supposed to be available to people who don't already have coverage offered to them from an employer or other government-sponsored insurance. So this really kind of whittles this population down to, I mean, typically people who are self-employed, people who work part-time or who work per diem and don't have affordable health insurance offered to them through an employer. But one thing to note is that if someone does have this affordable qualifying insurance from an employer, they cannot get tax credits. However, if the individual or household qualifies for Husky A insurance or Husky D insurance, they may choose to waive their employer coverage, and they would be able to take this other MEC available to them, other minimum essential coverage available to them, the Husky A or D, through the Access Health Connecticut application system. I also want to touch on one of the challenges with these tax credits is that there is a grace period involved. So let's say if they're someone enrolled in a policy and a qualified health plan and are receiving advanced premium tax credits, as long as an enrollee makes that very first payment to effectuate the coverage, because they're receiving these tax credits, they actually receive a grace period for paying the premium to the insurance company, and it's a 3-month grace period. So one thing that I have noticed looking through complaints and appeals and just helping out people with their applications or with some of their problems is that and it also leads back to reconciliation, if a primary applicant is enrolled and is receiving these tax credits, but then they decide to let the policy terminate by not paying it, typically someone would need to call in to Access Health Connecticut and call to request a termination of the policy. I've noticed, again, some consumers would sometimes allow it to just terminate by not paying, and what they usually don't know is that the insurance company gets to keep that tax credit for the first month of the grace period, which means at the end of the year, the household is going to receive a 1095A tax form from Access Health Connecticut showing all the months in which they had coverage on all of the tax credit that was received in order to prove that, yes, they complied with the individual mandate, they got minimum essential health insurance coverage, but then they'll usually see that there is a tax credit showing for a month in which they thought, oh, well, I didn't pay the premium for this. Why is this tax credit still showing up on my form? And it is because that the insurance company gets to keep that tax credit, that portion of the premium, for that first month of the grace period. And that does have a real financial implications for the enrollee, because they would still be responsible for reconciling that tax credit when they file their taxes. So one of the ways that someone or a household can kind of try to avoid getting into a situation where they may need to repay a lot of, or rather just repay any tax, is choosing to take either some or none of the tax credit, if feasible, available to them during the year instead of taking that full amount. At the end of the application, there is the option for an applicant to, it's a slider. They can either choose to take the maximum amount of tax credit that is available to them based on their projected modified adjusted gross income and household size, or they can choose to take just some of it, or they can choose to take none of it, and they can collect any tax credit that may be due to them at the very end of the year. You know, I understand that a lot of families are usually looking to take the maximum amount just because they're looking to make that coverage as affordable as possible throughout the year. But if at all possible, I do try to let people know that this is an option, because sometimes, especially if someone their income puts them right on the cusp of eligibility for these tax credits, this can be a really good way to kind of try to avoid a higher tax liability there. And I think I had touched on this, but using Form 8962, and I have some pictures on the next slide, the household will take that 1095A they get from Access Health Connecticut and use it to fill out this 8962 form. And this is really where the the comparison between the actual income within their Access Health Connecticut application is compared to the income that the household really ends up making at the end of the year. One thing I do want to note about that is that there are actually caps for how much tax credit someone would have to repay. So I've seen, for example, sometimes there's, let's say, a household of one person. They receive, let's say, $3,600 in tax credit throughout the year. Their income ends up placing them, let's say, at the 380% federal poverty level. They are, and this would typically require them to pay back quite a bit of tax credit. They would actually be capped off at $1,250. So I've seen, quite some instances where someone is questioning how much they've had to repay, and looking at their tax form, it looks like they actually made out with some extra benefits throughout the year that they didn't have to pay back, because there was a reconciliation cap in place for them. So going on to the next slide, these are the two forms that the one on the left, the 1095A tax form, that is what someone or a household would receive from Access Health Connecticut. That shows the breakdown in columns A, B, and C of the cost of the premium, as well as the second lowest cost silver plan. That is the benchmark plan from which Access Health Connecticut, or any exchange for that matter, uses to determine the maximum amount of tax credit someone can be eligible for. And then column C, down at the bottom, shows the amount of tax credit that someone actually receives. And then they would take that form, they would use it to fill out this 8962, or bring it to their tax professional to have them help fill out the 8962. And at the very bottom, they would find out whether they are subject to the reconciliation cap, if they are able to receive any additional tax credit at that time, or if they have to pay back the sum of the tax credit they had received. Now, someone would need to repay the sum of the tax credit they received if at the end of the year, their household's modified adjusted gross income exceeds the 400% federal poverty level. This is true even if at different points in the year, their annual income projection was not over the 400% federal poverty level. So it kind of brings me back to my point that sometimes it might be good for a household to take less than the maximum amount available to them to try to mitigate that payment. So when somebody reports changes to Access Health Connecticut, or rather, households are required to report changes to Access Health if there is a change in their household size, if there is an income change, if there's a change in tax status, etc. And they're required to do that within 30 days of the change, and the clients and all their consumers are notified through written notices sent to them. But as they make these changes throughout the year, sometimes that will change their eligibility for Medicaid, or their cost sharing reductions, or the amount of advanced premium tax credits they're getting, or whether they get those benefits at all. One thing to keep in mind, and I find that consumers don't always know this, but just because they lose eligibility for one level of financial help doesn't mean that they don't have access to coverage any longer. This involuntary loss of minimum essential coverage actually opens up a qualifying life event, which means that the household would have a special enrollment period in which they could change into either a different level of plan, or perhaps become newly eligible for Medicaid, or newly eligible perhaps for a qualified health plan with advanced tax credits. All of these changes, with this qualifying life event, they would be able to make these changes throughout the year and enroll into different programs throughout the year, even if it's not open enrollment period. All of these changes are forward-going, and this will typically result in the households receiving more than one 1095 tax form. So let's say somebody is enrolled in Medicaid for the first 6 months of the year, and then reports a change once they become, once their hours start to pick up at work, and they would then move into perhaps qualified health plan. they would receive a 1095B form from the Department of Social Services to show that minimum essential coverage they had the first 6 months of the year, and then they would also receive a 1095A tax form from Access Health Connecticut that shows the minimum essential coverage they've had through the qualified health plan, possibly with advanced premium tax credits. So I found the very best way for a household to find out if they qualify for any level, if they qualify for financial help or the level of financial help that they might qualify for is really by completing an application through Access Health Connecticut. I put a little picture in the corner here. Quite a few of you might be familiar with this tool. It's referred to as anonymous browsing on the Access Health Connecticut website. It's right on the home page, right in the middle. You can click on individuals or families, and it's this feature where you could put in someone's ages, the counties, whether they're a dependent or a spouse of yours, as well as the household's projected annual income, and it will provide an estimate of how much financial assistance they will receive or what level they will receive. The one thing I want to note with this is that while it can be a very helpful tool to give someone an idea of what they qualify for, it is not the most accurate way to find out really what someone's eligible for, because it's not quite sophisticated enough to take into account that not everyone in the household may be looking for coverage, or there might be some people in the household who already have access to affordable minimum essential coverage, and those nuances really do determine and can have a very large impact on how much tax credit a household can receive. So I'd say if someone wants to find out, of course, this tool is a good place to kind of give them an idea, but the very best way is by just completing an application. I've found sometimes with some appeals or just generally questions from consumers, they get confused with this very first question on the application. It is a very important one that asks them if they would like to be considered, or rather, do you want to find out if your family can get help paying for health coverage? They would have to select yes in order to even have the options come up for the qualified health plan with tax credits, Medicaid, or CHIP. If they select no, they will only be shown when they submit an application the full price qualified health plans. So if by chance you're working with a consumer and they said that they should it's usually that they should typically qualify for Husky. They've had it in the past. They don't know what's going on, and I found that sometimes the way they answer that very first question can be an issue. So you'll want to make sure that they're selecting yes. And this brings me right to our frequently asked questions. So the first one I get from consumers a lot is, what if my income fluctuates throughout the year? And so going back to the idea that tax credits are only available to people who don't already have access to affordable and minimum value or minimum essential coverage. Again, typically, then the people who are left qualifying for tax credit are the people who do have fluctuating income throughout the year because they are working part-time, they're working per diem. So it's a very special challenge trying to project your annual income for the entire year if you're in this situation. So in self-employed individuals, I'd say that we probably get this question a lot from them. So there's actually a couple of ways to go about this. If you are working with a client or advising somebody, the first option is that they would report changes as they occur throughout the year, and this really may end up with a result in this household or this individual fluctuating correctly between Medicaid coverage and possibly a qualified health plan with tax credits throughout the year. That can be kind of difficult for people, especially if perhaps there's an issue with, there's a provider that they go to for that does not accept Husky coverage, or even just the back and forth of trying to coordinate all your benefits can be kind of tricky, but of course that is an option. And then the other option is actually maybe a little easier, and again with self-employed individuals, this might be a better option, is to estimate out the projected annual income for the entire year and maintain that qualified health plan with tax credits. And this is especially so if at the very end of the year, the income is going to bring them over that Medicaid annual income threshold, and that'll really help with, again, especially, I think it can be really hard for consumers who are bouncing back and forth between Husky coverage and that qualified health plan throughout the year. And then another one of the big questions we get from consumers is, if I or if my household has no income or a very low income projection at the beginning of the year, but then ends up earning a higher income later on in the year, do I still need to repay all those tax credits I got? And the answer is yes. So it may not seem quote unquote fair to some of the consumers. A lot of times they will come back and say, well, if I was really eligible and really needed the assistance at this time, why would I now need to pay it back just because I got a good job? I did the right thing. I called Access Health to terminate my coverage. But as the law is written, as long as that household goes over that threshold right at the end of the year when they're filling out their 8962 form, they will be responsible for repaying either some tax credit, or in some cases, you know, I've seen it where customers will get a really great paying job halfway through the year. They'll get off of Access Health. But it's possible if they receive, you know, a few hundred or a few $1,000s in tax credits at the very beginning of the year, they are still responsible for repaying those. So it's a very fine line when it comes, again, there's a very special challenge in projecting out your annual income for people who are who qualify for these advanced premium tax credits. So it is no easy task, especially since, again, this population already probably has a fluctuating income. And with that, I guess we will turn it over to any questions that we didn't already cover.
So this is Kim again. I'm just going to say a few words here before we do take questions about opportunities to partner with Access Health. And if you've been with us before for a webinar, you've heard this before, so I promise I won't be long. We have our new this year community partner website, which is a source of fantastic information at learn.accesshealthct.com/community. And in fact, this webinar will be available there shortly after we record it and send it over to our IT person. We would love it if you could go to that site and sign up for our email list. We only send out 1 or 2 emails a month. It is not a huge burden on your inbox, but there always is great information about what's going on with the Affordable Care Act and Access Health. As you can see, some of the educational materials available on the Community Partner website are varied and covers everything from once you turn 26 and are aging off your parents' plans, to immigration status, to tax penalties. There's all sorts of things on there for your clients. It's really a great source of education and materials. We would love it if you could invite us to any events you're having. If you want an Access Health table, Access Health CT information, we would just be thrilled to have you include us. To get us there, you either email outreach@accesshealthct.com or fill out, there's a form on the Community Partner website that you can also fill out. So again, we really urge you, if you're not already one of our community partners, please become one. Call us at 860-327-5517, or again, email outreach@accesshealthct.com. Visit the webpage, and also please follow us at Access Health CT to get to our social media coverage. So now if you go to the chat box, just quickly, I put a link to a survey there. We would really love you to take just 5 minutes to go fill out that survey so that we know if we did a good job conveying this material to you or what we need to do better. Our next webinar is going to be the overview of the Consumer Decision Support Tool, and that'll be this coming Monday, December 12th. Join us for that one as well, and sign up at the community page. And again, Now we can go back to questions for either myself or for Monica. We did have a question come in early on that says, regarding Husky A for a newborn for an unmarried couple that are cohabitating. So they live together, but they're not married, the parents. Can the infant be on Husky A if mom does not work, but dad does not have a child support order, but mom and child are supported by the dad anyway? If the couple live apart, must the mom file for child support if she is already supported by the dad or the child?
Oh boy.
Complicated question.
It is. So I would think that as long as the mother's income, I mean, if she doesn't work, then I would believe that the child would be able to stay on Husky A just because I would think that the mother here probably claims the child, and the mother would probably also qualify for Husky A. I actually may need to go back to the Department of Social Services with this question just to see if there are any other types of rules around Husky A for the mother and the father, just because his income may affect the mother's ability to get Husky A, but as far as I understand, from what I can tell from the situation, the child should be able to maintain their Husky A.
Okay, so Louisa, if you want follow-up to that question, if you want Monica to go to DSS and find out more, can you please email the outreach at accesshealthct.com, and I will forward it to her and she can take that further for you. The next question is, how do I go about taking the test/exam to become a certified application counselor? My manager would like me to take that. So it is my understanding right now that we are at capacity with CACs and that we're not taking new ones. I don't know if that's going to change next year, but for now, I'm sorry, but that's not possible. Are there any other questions? Tax reconcile. Can you explain what that means?
As I understand it, reconciling means that somebody files their 1040 tax form with the 8962 form completed. I don't believe it means that they have made payments on all of this, on the amount of tax credit that they possibly would owe back. As far as I know, the reconciliation is just that filing of the 8962 with the 1040.
So I think in layman's terms, that means that the governing body is comparing what you owe with what you paid.
Exactly.
Okay.
So it's the yes, exactly. Thank you.
No problem.
It's the comparison of the annual income from the Access Health application and how much and how many benefits in the form of tax credits someone is receiving versus how much actually is made at the very end of the year, and it's that comparison there.
So it's just meaning that your tax credits were accurate, and just in case you either owe money or will get additional money back.
Yes.
Oh, another question. I contacted DSS via email regarding Husky A questions. They report they have no contact person or phone number for questions.
I believe that there should be, there is a benefit center at the DSS, and any of those workers who answer in the benefit center should be able to answer questions about Husky A. Especially with regard to benefits and providers and that sort of thing. Access Health Connecticut really just controls the application and eligibility process and sends that information over to the Department of Social Services.
But again, if you're not getting satisfaction from your question, email the outreach email, and we'll be able to help you.
Yeah, and maybe direct to the right phone number.
Yeah. Okay. Any more questions? I'm just going to wait a moment to see if anybody has any more. I just really want to take a moment to thank everyone for joining us. This is a complicated subject, and I think Monica did a fantastic job trying to make it a little bit more clear for everyone. Okay, I think we have no more questions, so this is going to end the webinar. We appreciate your interaction with us, and we look forward to the next one on Monday. Thank you, everyone.
Thank you.